So we've had a couple questions come in about who are the people, I think, at highest risk for contracting monkeypox. So one of the questions relates to should women who have sex with women worry about getting monkeypox or get vaccinated? We had another question come in from a cisgendered hetero man in a monogamous relationship who's wondering if he should be concerned about traveling and the risk of him and his family being exposed to monkeypox. So Dr. Koo, could you maybe talk about right now at this point in time, who we're considering the folks at highest risk for contracting it, and what should other folks who maybe aren't in that high risk group know and be aware of, but not be, overly concerned about at this point?
So I try to make this as simple as possible. So there are some criteria that medical providers are recommended to look at to determine whether someone coming in with a rash that's not readily explainable, could this be monkeypox or not? And then this other question that you're asking is who are really at risk for getting monkeypox and such. So there are some overlaps. So I'm going to say it's again, monkeypox is primarily from all the cases during 2022, the vast majority of the cases are contracted primarily through prolonged direct contact with someone who's infected. So it's to answer the question, if it is a woman having sex with another woman, do they have risk? The answer is yes. If the other woman if one of them are infected, the other at risk for getting infected. So it's not a sexuality kind of specific or sexual orientation specific illness, but that's the fact that it's really come down to is what type of activity you're participating and where you're kind of being exposed. If either of those women who have multiple exposure to others with anonymous partners or multiple partners, then the risk goes up. Now, to kind of answer the question about the cis man who straight man who is is just going to another to an area where there are some reports of monkeypox. I want to kind of first emphasize is that monkeypox, even despite everything that we're kind of talking about, it is not as contagious and doesn't spread as readily as many other diseases. But certainly, it is nothing anywhere close to being like COVID-19. So the number R naught that we like to use as an index, indicator of how infectious a particular pathogen is, monkeypox is about 1.4. And what that means is that for every case of monkeypox, the potential of spreading to another, there is a potential to spread to 1.4 other persons versus SARS-CoV-2, the virus that causes COVID-19, and I'm using the most recent variant, the Omicron variant, we're looking at an R naught of 8 to 10. That means one person who's infected can infect 8 to 10 other people who are not infected. So just to kind of give you an idea of where it is not that contagious in that sense, but doesn't mean that you shouldn't take precautions. Certainly someone who, going to another country, you certainly want to take some of the extra precautions. Hand washing, for example, definitely want to wash your hands. I mean, it's not just for monkeypox, for other things as well, right? COVID-19, other germs, but also you want to, you probably want to be a little bit avoid a few other things. The things that we kind of mentioned about, be mindful of going to participating in activities where would there be a lot of skin-to-skin contact? Will there be people who are more clothed or less clothed? Certainly wearing more, being fully clothed will reduce your risk compared to being less clothed. So there are, it's really kind of the risk, the activity that you're participating, and as well as some of the other factors, such as where you're going to be and how and what kind of activities you're going to be participating. So I know it's a little kind of hard to exact, but it's we're really looking at more of a spectrum rather than this is definitive that you did this, you won't get it. But certainly, there are many things you could do, some very straightforward things you can do to significantly reduce the risk of getting monkeypox. You're on mute again.
Sorry, guys. I'm the worst at that. Dr. Staci, we've got about 15 minutes left, and I wanted to make sure we touched on information related to the vaccine. So I was wondering if you could just give us an overview of, what is the vaccine? How effective do we think it is right now? There's been some stuff in the news about how they've changed how the vaccine is administered, and has that changed anything in terms of effectiveness of the vaccine? What are some of the side effects that people might experience, if any, from the vaccine, those kinds of things?
Absolutely. So Jynneos is the name of the vaccine that is available right now. And it is important to know that even though it is a live vaccine, it is not capable of replicating. So unlike some of the other live vaccines that you may have heard of, you don't have to be worried about anybody living in your household and spreading it to them. Or if you have HIV, you don't have to worry about getting this vaccination. So that's what's nice about Jynneos. We do have Jynneos at RiverStone Health, at the Public Health Department. And if you're listening in from another county, then you can contact your local county to see if they have the vaccine or if it's in a county outside of there. But it has been strategically placed throughout the country and throughout the states to be able to get it to as many people who are at risk as possible. So how do we do it? So yes, it's been changed. So initially you were supposed to get like 0.5 milliliter put in into a muscle, okay, and that was into the upper arm. They've changed that now, and the reason that they changed that was to get it out to more people, and they found that it is just as effective if they give 0.1 ml and they put it under the skin of the forearm. Okay, so even though we're doing it a little bit differently, it is meant to work just as well and be effective. Now, the way it's done is you get one, and then 28 days later, you get the other, and it would be typically on the forearm again. You're considered maximally protected after 14 days post your second vaccination. So you've got your first one, you get your second one 28 days later, 14 days after that, you would be considered maximally protected against monkeypox. It is considered about 85% effective, meaning that it is not foolproof. If you have the vaccination and you are exposed to somebody with monkeypox, you may still get monkeypox. However, it is thought that it will make it much less severe if you are exposed to monkeypox. And I guess I would turn over back to you, Eric, about the logistics here in RiverStone and how many vaccines we have available.
Sure. So in Yellowstone County, here at RiverStone Health, we have over 300 doses available. I will drop into the chat here our webpage for RiverStone Health, where you can go. It has the phone number you can call, an email, or a confidential form that you can complete online to get connected with our vaccinators for the vaccine. We can get people vaccinated very quickly, within a day or two at the most, if people want. So check out that link. And that will give you all the information you need to find out where you can get vaccinated at RiverStone Health. If you live in the surrounding areas around RiverStone Health, and your local health department isn't a health department that has vaccine available, please call us. We can either vaccinate you or figure out how to get vaccines to you if transportation is an issue. Or we can tell you if there's a closer local health department that has vaccine available.
I'm sorry, Eric, you also asked me to comment about the side effects from the vaccine. So
Yeah.
I think I'll do that right now. You know, since we're giving it intradermally in the forearm, by far the most common side effect is you'll get a little bit of redness and swelling where the vaccine is placed on your forearm. If anybody is actually familiar with getting a tuberculin skin test, or a PPD we call it, it looks a little bit like that. It looks like a positive one, actually. It's not, but it looks a little like that. And so just a little bit of local redness, maybe a little bit of tenderness, swelling, itching is what I've heard as well, some itching in the arm. There is the potential for getting possibly some swollen lymph nodes, a little bit of malaise, and just kind of feeling a little bit unwell, but actually I've not heard that from the people I know who've been vaccinated. It's mostly just been those local site reactions.
Yep.
You're muted.
We're down to about 10 minutes here. So I just wanted to see if there are any last thoughts that Dr. Koo, Dr. Staci, Jace, Walt, that you guys would like to speak to while I'm posting the information for where to get the vaccine at RiverStone.
So I have one thing I'd like to kind of really bring, and hopefully I'm going to condense this as much as I can. So a lot of our discussion here has been really focused on what are our risks on, and to some degree, well, how do we minimize our risk? But speaking to the LGBTQ community and such as that, it's easy for the CDC or anyone, a straight doctor to say, don't have sex. All right, if you're going to minimize your risk of getting monkeypox, you should just not that. And then it's really really kind of not the most reasonable answer to give. So this is what what I want to kind of implore as, look, you do want to make sure you make the right good choices. If you're going to decide to have sex, continue to have sex, you really want to be smart about it. And first thing is, as we kind of been emphasized, is get vaccinated. If that will be the key factors in reducing the risk of getting monkeypox. But even more importantly is that please abstain from having sex until 2 weeks after your second dose, because you can still get monkeypox after the first dose or immediately after your second dose. So you want to let the vaccine reach its full protective effect before you're going to participate in any sexual activities. Again, we've kind of been focusing on talking about a lot of multiple or anonymous sexual partners having, and this goes along with HIV and other sexually transmitted infection, as having sticking with a monogamous partner is much better than going, will have a much lower risk than having multiple partners or anonymous partners. But if you decide to have sex, go and and you want to have sex and you have anonymous or multiple sexual partners, again, limit the number of partners you have. Talk to your partners about any rashes or lesions that either of you have. Do some foreplay and explore and look for rashes. If you find an unexplained rash, don't have sex. You don't know what it is. It may not be monkeypox, but could be something else. Syphilis, we have a lot of that going on. I mean, it could be herpes. So be smart about this. I mean, and just take that time to really kind of look at each other's bodies and make sure that there's no, to make sure there's nothing ominous that's happening. Ideally, even, if you could, I know CDC kind of suggested virtual sex. If you could do that, that's a very good strategy to lower your risk. Or masturbate at a distance. Again, having sex with clothes on is another suggestion. Not sure how well that works, but if you can pull that off, that's also will help lower your risk. Definitely avoid kissing someone who you don't know or exchanging spit. Any of those things. if it's not someone who you know well and you have had a monogamous relationship, you really want to take some cautions. And then we talked about a little bit about contaminated surfaces or fomites. So don't share anything like towels, sex toys, fetish gears, any of those. If you do, wash them very well before you do something, before you use them again. Because again, those if you don't, it will make, again, they can be contaminated with the monkeypox virus and then pass it to you or to someone else. So those are the things I really kind of want to kind of find. Is not saying that you shouldn't have sex, but you have to be very, very smart about that. Yes, if you can avoid having sex, that's be perfect. But again, the reality is that probably a lot of people can't do that. But then you just really have to take some really good, try to take some good steps to minimize your risk. Last note: any anonymous. Well, it wouldn't be anonymous, I guess. Anyone who you don't have a monogamous relationship with, you're having sex with, it's a good idea to kind of exchange information. I know we're all really into to maintain our privacy, and that's kind of part of the whole, the Grindr and Tinder. Well, mostly Grindr. All these apps and online website is that to have that anonymity, but it's important that, if you do develop monkeypox, at least we have some contact information to notify those, who you had contact with, so that, to help with the contact tracing, so that, so we can warn and prepare or treat, if necessary, those who may have gotten infected.
I just want to jump in really quickly, if it's okay. I did get a private question sent to me about treatment options for monkeypox. And so I just want to briefly say that the majority of patients don't actually require treatment, can be managed symptomatically in the outpatient setting. And when we diagnose you with that, we will tell you exactly the sort of things that you can do to stay comfortable, and we can help you with pain management and all of these things. Some patients, though, do require treatment with tecovirimat or TPOXX, and that is also something that is distributed through the strategic supply. And it would be available if you were hospitalized, certainly, also to other patients who may be considered high risk with immunocompromising conditions, HIV that is not well controlled, other things like that, skin conditions and such. So yes, I'm sorry, we didn't hit on that a lot at this, but I think it's mostly because the majority of patients don't require treatment. And my last statement, I guess, would be not so much about monkeypox, but about your sexual health in general. If you don't have a primary provider, I really encourage you to look into getting a primary provider. We are really passionate over at RiverStone Health about discussing safe sex and options to keep you safe. We are very pro-PrEP at RiverStone Health, so we can provide Truvada, Descovy, and we are about to start giving cabotegravir, the Apretude that you may hear of as the injectable PrEP. We are happy to test you for sexually transmitted infections and treat those if found. So please know that you have a safe place to go, and there's no judgment. We're used to taking care of patients with issues related to their sexual health, and we're happy to help.
Thanks, Dr. Staci. Yeah, there's so much we could talk about with this thing that's new to so many people right now, that we could go on for a long time. I've been trying to drop in some choice links for people to follow if they want to get more information. Jace, any last words?
Oh, I think we've got a good team here, and Dr. Neil and Dr. Staci are on top of everything. Our public health team will work with anybody who has any questions or has an exposure. We'll do whatever we can to help you find the resources to make sure you're safe and can keep safe and keep your rent and housing utilities going too while you're quarantined. So we're here to support anybody. Sex is good. Sex is great. Have all the sex you want. Just be careful out there right now. It's just stuff going on. And all of the doctors and providers I know of are open to talk to anybody about their sexual health and sexual history. It's not taboo. It's not a bad thing. People have sex. We're here to support them and have safe, healthy sex practices.
Thank you, Jace. Walt, any last things to wrap us up here?
Yeah. Yes, I wanted to say thank you to everyone for coming in. Thank you to RiverStone for starting this again and bringing Billings Clinic in. Just want to point out again that vaccinations will be at the RiverStone Health Clinic. And I want to thank everybody and just ask real quick out there in the video land, do we want to do this again? And with that, thank you from 406 Pride, and thank you for helping our community. I'm damned impressed, actually. Thank you very much.
Thanks, Walt. We'll send out a follow-up email to folks who were registered for the event and ask if there are any questions that come up for them after this, and if we need to do another webinar. I'm sure as this outbreak unfolds, things will change, and we'll be back and communicating more information with everyone as we learn more, as we know more, as we hear more. So stay tuned, and we will work to get the information out to people as best we can. So thank you again to oh, go ahead, Walt.
I would just ask anybody, the participants, please drop your thoughts at the 406 Pride Facebook page. We're trying to build community here. Thank you.
Thanks. Thanks again to those who participated, and have a great night, everybody. Thank you to our panelists. I really appreciate your time and energy and caring in this.
Thank you all.
All right, bye-bye.
Bye-bye.